Hey guys, welcome back to Pharmacotherapy series on Pharma palette. Have you ever wondered why some patients feel breathless even while resting? Or why the fluid starts accumulating in the body when the heart becomes weak? Today we are going to simplify this heart failure till diagnosis in a simple, high yield exam oriented way. No confusing explanations, just concepts and tricks that help you understand and remember better. So, coming to the introduction, heart cannot pump the blood properly. Actually, when the structure and the function of the heart, if it is having any problem, the heart will not pump the blood properly to meet the body requirements. So, that condition is called as heart failure. So, this condition can occur due to two things. One is systolic dysfunction and diastolic dysfunction. Systolic dysfunction means here the heart contraction is weak. In the diastolic dysfunction, it cannot relax properly. So, the poor relaxation is the diastolic dysfunction. So, based on the ejection fraction, this is divided into two things. One is heart failure reduced ejection fraction, heart failure preserved ejection fraction. To remember the causes of this heart failure, just remember one trick, which is HIPV card, where H means hypertension, I means ischemia or myocardial infarction, P means it is pressure overload, V means it is valve diseases, C means it is cardiomyopathy, A means it is coronary artery disease, R means it is regurgitation, D means it is dilated heart. So these are some common causes for this cardiac failure. So due to the various causes of this cardiac failure, they will be leading to the decrease in the cardiac output. At that point of time, there will be activation of certain mechanisms. Those mechanisms are called as compensatory mechanisms. And to remember all the four different compensatory mechanisms, just remember the words fast, water, tight and big. Where fast means it is speed, so there will be increase. Fast means it is increase. So the first mechanism is sympathetic nervous system activation. So in the sympathetic, whenever the sympathetic nervous system activates, it will be always increasing the activities. Like it increases the heart rate, it causes the force of contraction. So first one is sympathetic nervous system activation. Second one is fluid, water. So there is fluid retention is the second compensatory mechanism. Like what happens in this, the sodium and water will be retained in the kidney, due to which the blood volume will be increasing, and that's where the circulation will be maintained. Then the third one is tight. So tightening of the vessels is simply vasoconstriction. So this is done mainly to maintain the blood pressure. And the last one is big, which it is increase in the size. So hypertrophy means it is increase in the size, so that is big. So there is ventricular hypertrophy and remodeling. So these are the four different compensatory mechanisms that are activated whenever the cardiac output is reduced. And this is the simple trick to remember the four mechanisms. And if this compensatory mechanism, or if there is long term compensation in the body, it will be leading to certain conditions like increase in the heart failure and increase in the workload. In the etiopathogenesis, we have seen the causes. Then we saw how these causes will be reducing the cardiac output, due to which the compensatory mechanism got activated. Now, the next thing is the neurohormonal activation. In the neurohormonal activation, there are some substances like angiotensin 2, norepinephrine, aldosterone, vasopressin. All these substances will be getting overactivated. It is simply called as the chronic activation. So, if there is chronic activation of these substances, it will be leading to the conditions like MI, inflammation, oxidative stress, and ventricular remodeling. When this occurs, because of all these conditions, the heart becomes weak and it becomes very less efficient. That further leads to the symptoms like shortness of breath, fatigue, edema, decrease in the exercise tolerance. Now, this is the complete etiopathogenesis. Now, let's get into the clinical presentation. So, to remember the clinical presentation of this congestive cardiac failure, Just divide the symptoms into different groups. One is the primary symptoms, GI symptoms, pulmonary symptoms, and fluid overload. In the GI symptoms, remember the trick as banana, where B means it is bloating, A means anorexia, N means it is nausea, A means abdominal pain, N means no appetite, A means ascites, and sometimes weight loss can be seen. And coming back to the primary symptoms, remember the trick as D fat, where D means it is dyspnea, F means it is fatigue. Fat means it is fatigue. And coming to the pulmonary symptoms, remember the trick as PCOT, where P means it is pink frothy sputum, paroxysmal nocturnal dyspnea, C means it is cough, O means it is orthopnea, T means it is tachycardia. Next one is the fluid overload. When the fluid gets accumulated in the body, it leads to the edema condition, which is peripheral edema, and pulmonary congestion can occur. So, coming to the last one, in case of physical examination, we can see the symptoms like this, which can be remembered with the code C3CJHH, where C means it is crackles, cardiomegaly, and cool extremities. J means it is JVD, which is jugular venous distension. H means it is HJR, which is hepato jugular reflex. H means it is hepatomegaly. For the GI symptoms, remember the trick as banana. Primary symptoms, remember it as D fat. Pulmonary symptoms, remember it as PCOT. Fluid overload, edema. Physical examination, 3CJHH. With these codes, the clinical presentation of this cardiac failure can be easily memorized. So, coming back to the diagnosis part of this congestive cardiac failure. So, to remember the diagnosis, remember this flow: see, test, image, echo, and classify. Where C means it is checking the characteristic signs and symptoms. Like if the patient has any of these symptoms like dyspnea, edema, fatigue, cough, orthopnea, then what is this dyspnea? It is simply the shortness of breath. And what is orthopnea? This is also the difficulty in breathing, but this is when the patient is lying flat. Difficulty in breathing when the patient is lying flat, that is orthopnea. So if the patient has any of these symptoms, so that is the first diagnostic criteria. And second one is the test. You will be performing certain laboratory test. This is mainly to identify the causes, to know the severity, and to detect the heart failure. Sometimes this laboratory test will be performed. And for the laboratory test, remember the trick as heart BNP, where H means it is hemoglobin, and E means it is electrolytes, A means it is A1C, R means it is renal functioning test, T means it is thyroid functioning test, B and P means it is B type natriuretic peptide. So you'll be checking for all of these laboratory tests, and sometimes the low sodium levels in the body can also indicate the cardiac failure. So you'll be checking for the hyponatremia, and then usually the levels of the sodium should be 120 MEq by L. It should be less than this. If it is more, indicates the heart failure, severe heart failure. Then the third thing is we'll be performing the imaging. In the imaging, just remember the code as XEC, where X means it is chest X-ray, E means it is ECG, C means it is echo. And in the chest x-ray will be performed mainly to identify the conditions like pulmonary edema, pleural effusion, and cardiomegaly. And ECG is performed to identify the conditions like ventricular hypertrophy. And then echo is one of the most important tests that is performed in case of heart failure. This usually shows the conditions like LVEF, valve problems, and it tells the systolic dysfunction and the diastolic dysfunction. So, coming back to the last part of the diagnosis is to classify. So, you will be classifying the symptoms. Classification of symptoms will be done based on four different functional classes. Functional class 1 has no limitation. Functional class 2 has mild limitation. Functional class 3 has marked limitation. Functional class 4 has the symptoms at rest. So simply you need to remember, as the number increases, the activity reduces. Apart from that, there is one ACC and AHA staging system. This will be usually providing a framework by which we will be able to evaluate, prevent, and treat this heart failure. So, that was the simplified understanding of congestive cardiac failure till diagnosis. Once you understand why the heart fails, the treatment becomes much easier to learn. And in the next video, we will break down the pharmacotherapy of this heart failure, the drugs, their roles, and the high yield points you should never miss in exams. This video helped you. Don't forget to like, share, and subscribe to Pharma Palette for more simplified pharmacotherapy content.